We talk about trauma-informed care and health equity. My guess is you've probably heard a lot about trauma-informed care. At least if you haven't studied it at all, you've probably heard it spoken because it's being talked about in a lot of circles these days. So, but we couldn't really get to talking about trauma-informed care until you understand what that is actually based on. Why have we moved to trauma-informed care models in so many things we're doing? So really what this is about is looking back at a study called the ACEs study. And ACE stands for Adverse Childhood Experiences. And this was a landmark study that took place in 1995 to 1997. And as you will see there in that first bullet point, over 17,000 members of basically an insurance, all under one insurance company, received physical exams and completed these confidential surveys regarding their childhood experiences. And what's fascinating about this is that what they found was that adverse childhood experiences were actually very common among the general population. And so what you will see is about 61% of adults across 25 different states, as this has gone on, have reported they've experienced at least one of the adverse childhood experiences. And nearly 1 in 6 reported they had 4 or more types, which is a lot. What we know about ACEs is that those of us who have had any of these adverse effects when we were children often are linked to chronic health problems later in life. So it's mental illness, substance abuse, all kinds of chronic health conditions that we see show up now. And it can impact, obviously, other things like, the negative consequences of being able to try to get work and those kinds of things. So what are these adverse childhood experiences? Well, basically, these are traumatic events that occur in childhood from the time we are 0 to 17 years old. So prior to your 18th birthday, basically. And these are some of the things that we see as adverse. Experiencing violence and abuse or neglect, witnessing violence in the home or the community, having a family member attempt suicide or die. If you look at the child's environment, that can undermine their sense of safety and stability and bonding as they're growing up. Things like that might be a household where substance abuse was happening, where there was mental illness present, or where there was instability due to parental separation or household members being in jail or prison, or again, you might lose a member of the family. I'm hoping I can show this little video on toxic stress, because this is kind of the foundation of what the study's about. So I'm going to see if we can get to this, and you'll need to let me know if we're doing okay here. Get this loaded up. Are you able to hear this?
Learning to deal with stress is an important part of healthy development. When
Can you make it any louder?
The stress response
Let me try to do that. Sorry.
Adrenaline rush, increased heart rate, and an increase in stress hormone levels.
Okay.
When the stress is relieved after a short time, or a young child receives support from caring adults, the stress response winds down and the body
quickly returns to normal. In severe situations, such as ongoing abuse and neglect, where there is no caring adult to act as a buffer against the stress response stays activated. Even when there is no apparent physical harm, the extended absence of response from adults can activate the stress response system. Constant activation of the stress response overloads developing systems, with serious lifelong consequences for the child. This is known as toxic stress. Over time, this results in a stress response system set permanently on high alert. In the areas of the brain dedicated to learning and reasoning, The neural connections that comprise brain architecture are weaker and fewer in number. Science shows that the prolonged activation of stress hormones in early childhood can actually reduce neural connections in these important areas of the brain at just the time when they should be growing new ones. Toxic stress can be avoided if we ensure that the environments in which children grow and develop are nurturing, stable, and engaging.
If you could just do a hand on the screen, how many of you are familiar with the ACEs study? All right. How many of you are familiar with toxic stress? If you'll raise your hand. How many of you have heard of trauma-informed care before? Now, this is public online. Anyone can take this. And this is a little bit of a combination of wording. I didn't do it, but this is the CDC is the one who really has done most of the work in all this area. So they have reworked the words a little bit, but basically these 10 questions you can do in most any group, and I don't care what the group is, and a certain number of individuals will come out with 1 to 5 of these. So I'm going to ask you to take a minute. This is totally private. I'm not going to ask you to share, but I'd like for you to take a minute and just jot down your answers to some of these, to all of these, to these 10, and it will only take a couple minutes to do this. Raise your hand if that was difficult to read. Raise your hand if you know anyone, including yourself, that has had 1 to 3 of those experiences. Raise your hand if you or yourself, you or you know others who have had more than 3 experiences that were on that test. As I look at this, whether any of these things apply to you or to people that you know, there were some pretty heavy duty questions on there. And one of the risks that we take in even sharing those questions is you don't want to trigger someone's trauma. So I wanted you to see this because I think it's really important for us to know what the contents of this is. If you got triggered, I want to apologize, and I would encourage you, if there's somebody you want to talk to, please do that, or you certainly can reach out to me, and I'm happy to talk with you about any kind of resources. As I said, in most groups, there is positive ACEs numbers on pretty much everyone that takes this or they know of someone. So what does this have to do with trauma-informed care? So let me go back to sharing my screen here. So the reason why the ACEs study has become so important for getting us really over to trauma-informed care, I'd like to think it was mostly because, yes, this is great work and we want to help reduce people's trauma and stress. But the truth is, I think underlying a lot of this was the medical community began to recognize that so much of what we spend on healthcare could potentially be prevented if we started focusing on helping people to either not have these experiences at all, or to pay attention to them in a different way when we're treating them in healthcare, and not just, physical healthcare, but also mental health. So the first piece here, preventing ACEs could potentially reduce a large number of health conditions. So we're talking about 1.9 million cases of heart disease and 21 million cases of depression. Now, do we know for certain that we could potentially avoid all that? We don't know, but that is a guesstimate when you think about the number of people that are living with chronic disease that come from experiences that were adverse in their childhood. Some children are at a greater risk than others. We talk about women, and several of our racial ethnic minority groups are at higher risk of having experienced 4 or more type of ACEs. And so why is that? Well, because we have extenuating circumstances such as poverty, racism, sexism, all of the things that we live with in an unjust society that certain marginalized groups end up carrying the burden for. Some children are at greater risk. Sorry, we just talked about that. I put that in there twice. Sorry about that. ACEs are costly, the last one. The economic and social cost of families, community, and society totals hundreds of billions of dollars a year. So you can see why we're trying to do more with this, because economics often drives everything. And if there's ways that we can figure out how to avoid some of this, then you're going to get buy-in from bigger systems that will help us get this work done, even though they may not have altruistic reasons for doing it. So what's missing from the tests that we just took, or the understanding of ACEs? It doesn't account for individual differences.
Hey, Karen, I'm so
Yep.
sorry to interrupt you, but we're still looking at the ACEs quiz.
Daggone it. So let me stop sharing again and go back.
Okay.
So when I stop share, I wonder why that's going to back to the quiz. All right, let's try this again. What are you seeing now? Are you seeing why is ACEs important?
Yes.
Super, thank you. All right, so those were the points I just talked about. So let me go down to, so what's missing? The individual differences. The test does not account for that. Not all children who have multiple ACEs will have poor outcomes. Not all children who experience any ACEs will avoid poor outcomes. It's the individual piece. And a high ACE score is simply an indicator of greater risk. It does not define that these are going to be bad outcomes for you. It just means you're at higher risk because you've been exposed. So then when we look at the stressors outside of the household, this has to do with equity and inequity, which is what I was talking about earlier. The test doesn't account for outside of the household: violence, poverty, racism, other forms of discrimination, chaotic environments, and the lack of services that could help mitigate some of these things. And it also doesn't take into account protective factors. How many supportive relationships a child may have had, were they engaged in community services, did they have opportunity for skill building? So trauma-informed care, where it connects to the ACEs, is if we view people as having had these adverse effects as children, then there's a developed process now that we say, okay, how do we be trauma informed when we're interacting with individuals? And this could be patients, it could be friends, it could be coworkers. What does that mean to have that kind of lens? Which means that I'm seeing you as a person. And there's basically 6. And some people say there's 4, some say it's 5. These are the 6 that are put out by SAMHSA, which is the Substance Abuse and Mental Health Services Administration. And this is the one most commonly used. And the resource for this is at the bottom. So these are the 6 things that we talk about when we talked about becoming trauma informed. How do we build safety? And when we talk about creating a safe environment, we're talking about creating a space where people feel physically and psychologically safe. In our organization, one of the ways that we do that is we try to make sure we see every person as an individual that is worthy of respect, who has a story, who we approach holistically and who they are as a human being. And we try to make sure that we do not make assumptions about them, no matter who they are, where they come from, what they believe, what they think. And so that means suspending our judgments and our biases towards people to create a safe environment. And if you think about the people you feel safest talking to, when you think about the qualities that that person might offer you, those are the qualities that you try to build in, or I try to build in an organizational level, that we want people to feel welcomed and cared for and emotionally and physically safe when they enter. And this, again, these principles apply to any environment. Number two, trustworthiness and transparency. Maintaining trust, gaining trust, and ensuring that you keep that trust is so important for a person who has had any of these adverse childhood experiences. Because that trustworthiness and the transparency, again, these are the things that help mitigate and help heal some of the trauma that has happened before. The third one, peer support. And this is having to do with other individuals who've experienced trauma as well. Making sure that people understand they are not alone. There's mutual help in this process. How do we do that in a place like Health Brigade? We do it among our employees, for example, where we have opportunities for them who've been through the same experiences to be able to partner with somebody else who struggles with some of those same experiences. We create a safe enough environment where they can go to another colleague and talk through things to establish trust. And if there's help that is needed, you know, a classic case, you know, we have a member of the staff right now whose son needs a lot of help because he's in the middle of the COVID crisis and he's gotten in with a rough crowd and his dad is worried about his safety. Well, the way we mutually help with that is this colleague feels close enough to share that with a few of us and then ask permission if he could then share that with the full staff to see if some of us could help him help his son get a job that would help keep him safe. That's the peer support and the mutual self-help. Collaboration and mutuality, partnering and leveling of power differences. And this is a really big deal. When you go to the doctor, we automatically assume there's a power differential between you and the physician or the provider. When a provider decides to engage you more in your care in a way that is relational and is more about how do we partner in this and how do we help you get some control in managing your care, then that's power sharing. That gets away from the hierarchical, you're above me, you're better than me, I'm not worthy of you, just because you're a physician. And so this is very intentional work that needs to be done in organizations to create this level of collaboration and mutuality. It's the same thing in terms of employment and who's involved in hiring someone. Is that just the executive director or director of a department? Or do we create teams, employee teams that come together and share the power of helping to interview potential colleagues? That's just one example of how one can share some power in an organization. The fifth one, empowerment, voice, and choice. And this is incredibly important. People do better when they have voice and choice over how they are treated and how they receive services. So, for example, if we're talking about helping people to be more resilient, and I tried to underline a few words here rather than, you know, give you the whole written piece that you can certainly look at, but this is about focusing on individual strengths and recognizing people's experiences. And so when we talk about voice and choice, don't build a program to serve me that I haven't given voice to. How do you know how to serve me and my unique needs if you haven't heard my voice about those needs? Don't make the assumptions that you know what I need. And number 6, the cultural and historical and gender issues. And this really gets into where we have this intersection of equity and trauma-informed care. And this is really moving past those cultural stereotypes and biases. It's providing services that are responsive, gender responsive. In our organization, we have a lot of patients who come see us who are transgender. That means we have to make sure we get the pronouns right, that we take time to learn about transgender health, and that we keep ourselves always accountable to making sure we can provide that best care for that client. I'm going to stop just for a second and ask if there's any questions about what I just presented. Okay.
Hold on, I just got one.
Okay.
What training do employees receive to be better at these skills or attitudes?
Excellent question. At Health Brigade, we have a really strong program of onboarding when we bring in volunteers who also serve in the same capacity as staff. And we also do regular staff trainings within our organization. But we actually have a team that has been in place for 3 years on trauma-informed care, and it's our trauma-informed leadership team. And it's made up of individuals from each department. And so we continually have ongoing training, but we also have an environment where we give each other permission to confront each other around these issues, and to do that gently. But if someone has been misgendered, then they speak up and say to that person, please use the right pronoun or use my name. And so we've built a culture that really helps individuals, no matter which level you are, because we still have a hierarchy as well. But no matter what level you are, it is generally a culture where you are valued for speaking up and for self-advocating. If things get too rough and a person really can't get the skills, then we have to ask the bigger question, is this the right environment? Because in our environment, we're taking care of a lot of vulnerable people for various reasons. They're mostly individuals who are marginalized by race, by immigration status, by gender identity, certainly by poverty. And so for us, making sure that people have, our staff and our volunteers who help us have regular ongoing training for this is a big part of what we do. And our commitment to each other is calling each other out on that when we're messing that up. And we do mess it up. So let me just be clear about that. But we are doing deeper level work now more than ever, really around the health equity piece. So, and hopefully there's plenty of training still available out in the community. So if you wanted to learn more about these kinds of skills. I know that was a long answer.
There was a thank you for that, and I think we're good to move on. Yeah.
Okay, super. So I know we're tight on time, and I want to make sure I give a few minutes for questions at the end. But basically, this shift that we're talking about in being trauma informed is a shift away from not asking, what is wrong with you, or tell me your symptoms. It's more, what happened to you? Because we've all been through things in our earlier lives that have affected our physical and mental health to this day. And that doesn't mean it has to have been some huge traumatic event that you might recall. It could have been just toxic stress that happened at one point in your life, and then it got your neurons fired up. And that toxic stress over time, then resets your stress level. And it's very difficult once your stress level is reset to learn how to bring that back down. But if we get providers and those of us who are offering resources to people to be attuned to this, then resilience and healing can really happen and people can get better. This is just Oprah basically talking about when she interviewed Bruce Perry, that this was the life-changing event of her experience, that she went back and really looked at through this lens that he was talking about. And of all the people that she has ever interviewed, that this event was pivotal to actually changing her whole life, because she was raised in the Midwest and she had experienced so many of these things on the ACEs test that she never had words for it and she never really knew what happened. And so the bottom line that she comes out with is, whether we call it trauma-informed care or we talk about having significant people who care about us, she translates that this is about experiencing people who care about you and who love you. She uses the actual language of love and the importance of being loved and being seen, and that is the best thing we can kind of give each other. And that we have to, she actually uses the term, we have to stop asking what's wrong with you, and we have to ask what happened to you. And so when we look out at the world and we look out at people who do horrible things, the question that we should be asking, again, is not what is wrong with you. It's what has happened to you. And a classic example is looking at who occupies the White House at this point. I don't care where you stand in terms of politics. What we are seeing in the White House is a person who doesn't seem reasonable at all with the number of lies that continue to come out. And so you have to look at that and you have to say, what happened for this person to be this broken? And that's the kind of trauma-informed mindset that we carry with us, and that we should carry with us in every avenue that we're on. It doesn't matter whether it's in the classroom, whether it's in your church or your synagogue or any space that you're in. We're all fragile human beings, and we all come from tough experiences at some level. And the way that we help become better and get healed from this world of trauma that we all live in is to become more trauma informed. So I'm going to stop there. I apologize again for all of the technology issues. I will send the link so you can watch the piece on Oprah. It's about 5 minutes long, and I do think it's worth watching.